Hello, nursing students. Welcome to Nursing Exam Preparation, your trusted resource for excelling in nursing exams with confidence. In today's video, we'll be guiding you through 150 multiple-choice questions, MCQs, on narcolepsy, each designed to challenge your understanding and deepen your knowledge of this important topic. You'll find detailed explanations after each question, helping you not only choose the correct answer, but also understand the reasoning behind it. Whether you're just starting your studies or preparing for an exam, this video is filled with content to test your skills, enhance your critical thinking, and solidify key concepts related to narcolepsy. Don't forget to like this video, share it with your classmates, and subscribe to Nursing Exam Preparation for more valuable resources. Be sure to hit the bell icon to stay updated on our latest videos, all created to help you succeed. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's get started and work towards mastering narcolepsy and achieving success in your exams. 1. Which of the following is the hallmark symptom of narcolepsy? A. Excessive daytime sleepiness. B. Cataplexy. C. Sleep paralysis. D. Hypersomnia. Answer: A. Excessive daytime sleepiness. Rationale: the hallmark symptom of narcolepsy is excessive daytime sleepiness, EDS. This condition causes individuals to fall asleep uncontrollably during the day, often leading to dangerous situations. Cataplexy, B, sleep paralysis, C, and hypersomnia, D, are other symptoms but are not the primary hallmark of the disorder. EDS is the most prominent feature that differentiates narcolepsy from other sleep disorders. 2. What is the primary neurotransmitter involved in narcolepsy that contributes to the disorder's symptoms? A. Dopamine. B. Serotonin. C. Orexin, hypocretin. D. GABA. Answer: C. Orexin, hypocretin. Rationale: orexin, also known as hypocretin, plays a crucial role in regulating wakefulness and REM sleep. The deficiency of orexin in individuals with narcolepsy is a major factor in the development of the disorder's symptoms. Dopamine, A, serotonin, B, and GABA, D, are important in other aspects of brain function but are not the primary neurotransmitters involved in narcolepsy. 3. What is the most commonly used diagnostic test for narcolepsy? A. MRI of the brain. B. Polysomnography, sleep study. C. Multiple sleep latency test, MSLT. D. EEG. Answer: C. Multiple sleep latency test, MSLT. Rationale: the multiple sleep latency test, MSLT, is used to diagnose narcolepsy. It measures how quickly a person falls asleep during the day and how quickly they enter REM sleep. Polysomnography, B, is often used in conjunction with MSLT, but MSLT is more specific for diagnosing narcolepsy. MRI, A, and EEG, D, are not used to diagnose narcolepsy, but may be used to rule out other conditions. 4. Which of the following is a common pharmacological treatment for narcolepsy that helps reduce excessive daytime sleepiness? A. Stimulants like modafinil. B. Benzodiazepines. C. Antipsychotics. D. Antidepressants. Answer: A. Stimulants like modafinil. Rationale: stimulants such as modafinil are commonly prescribed to help control excessive daytime sleepiness in patients with narcolepsy. Benzodiazepines, B, antipsychotics, C, and antidepressants, D, are not typically used to treat narcolepsy's core symptoms, although they may have some off-label uses for related symptoms or comorbid conditions. 5. What is cataplexy, a symptom often associated with narcolepsy? A. A sudden loss of muscle tone triggered by emotions. B. Difficulty breathing while asleep. C. Uncontrolled jerking movements during sleep. D. Periodic paralysis during sleep. Answer: A. A sudden loss of muscle tone triggered by emotions. Rationale: cataplexy is the sudden loss of muscle tone, often triggered by strong emotions such as laughter or surprise. This can lead to weakness or collapse, but it does not involve complete paralysis, D, or sleep-related jerking, C. Difficulty breathing, B, could be seen in sleep apnea but is not a hallmark of narcolepsy. 6. Which sleep-related phenomenon is often seen in patients with narcolepsy, particularly during the transition between sleep and wakefulness? A. Sleep paralysis. B. Restless leg syndrome. C. Insomnia. D. REM sleep behavior disorder. Answer: A. Sleep paralysis. Rationale: sleep paralysis is a phenomenon that occurs when a person temporarily cannot move or speak while waking up or falling asleep. It is commonly associated with narcolepsy. Restless leg syndrome, B. Insomnia, C. And REM sleep behavior disorder, D. are not directly associated with narcolepsy, though they can occur in other sleep disorders. 7. Which lifestyle modification is most recommended for individuals with narcolepsy to improve their quality of life? A. Regular daytime naps. B. Avoiding all forms of exercise. C. Excessive caffeine intake. D. Sleeping for long durations overnight. Answer: A. Regular daytime naps. Rationale: regular daytime naps are beneficial for individuals with narcolepsy to help manage excessive daytime sleepiness. Napping helps to reduce the severity of daytime sleepiness and improve overall functioning. Avoiding exercise, B. Excessive caffeine intake, C. And sleeping for long durations, D. are not recommended as they can worsen sleep patterns or overall health. 8. What is the most likely outcome if narcolepsy is left untreated? A. Progressive cognitive decline. B. Increased risk of heart disease. C. Impaired quality of life due to uncontrollable sleep episodes. D. Complete loss of sleep altogether. Answer: C. Impaired quality of life due to uncontrollable sleep episodes. Rationale: if untreated, narcolepsy can severely impair a person's quality of life due to uncontrollable sleep episodes, including excessive daytime sleepiness and cataplexy. Cognitive decline, A, and heart disease, B, are not common outcomes of untreated narcolepsy. Complete loss of sleep, D, is not a symptom of narcolepsy, as the disorder does not affect total sleep, but rather the regulation of sleep-wake cycles. 9. Which of the following disorders is most likely to be confused with narcolepsy due to similar symptoms? A. Sleep apnea. B. Idiopathic hypersomnia. C. Parkinson's disease. D. Insomnia. Answer: B. Idiopathic hypersomnia. Rationale: idiopathic hypersomnia shares several symptoms with narcolepsy, including excessive daytime sleepiness and prolonged sleep periods, making it a condition that could be confused with narcolepsy. Sleep apnea, A, is a sleep disorder, but it primarily involves breathing difficulties rather than sleep-wake regulation. Parkinson's disease, C, and insomnia, D, have different primary symptoms and do not share the hallmark features of narcolepsy. 10. A patient with narcolepsy is experiencing excessive daytime sleepiness and has been prescribed modafinil. What is the expected effect of modafinil on the patient? A. It will induce sleep and prolong nighttime sleep. B. It will enhance wakefulness and reduce daytime sleepiness. C. It will reduce emotional triggers for cataplexy. D. It will improve muscle tone during episodes of cataplexy. Answer: B. It will enhance wakefulness and reduce daytime sleepiness. Rationale: modafinil is a stimulant used to enhance wakefulness and reduce excessive daytime sleepiness in narcolepsy. It does not induce sleep, A, reduce emotional triggers for cataplexy, C, or improve muscle tone, D. It is specifically used to manage daytime symptoms. 11. Which of the following is a key feature of narcolepsy associated with rapid entry into REM sleep? A. Sleep paralysis. B. Hypersomnia. C. Loss of muscle tone. D. Excessive daytime sleepiness. Answer: D. Excessive daytime sleepiness. Rationale: narcolepsy is characterized by excessive daytime sleepiness, which results in rapid entry into REM sleep. Sleep paralysis, A, and loss of muscle tone, C, are other symptoms, but they are secondary to the excessive daytime sleepiness. Hypersomnia, B, refers to prolonged sleep, but it is not specific to narcolepsy. 12. What is the most appropriate first-line medication for managing cataplexy in narcolepsy? A. Modafinil. B. Antidepressants, SSRIs. C. Stimulants, e.g., methylphenidate. D. Sodium oxybate. Answer: D. Sodium oxybate. Rationale: sodium oxybate is the most effective first-line treatment for cataplexy and narcolepsy as it helps to reduce the frequency and severity of episodes. Modafinil, A, and stimulants, C, are used to manage excessive daytime sleepiness, but they are not effective for cataplexy. Antidepressants, B, can help with symptoms, but they are not the first choice for managing cataplexy. 13. Which diagnostic finding is most indicative of narcolepsy during a sleep study? A. A prolonged period of slow-wave sleep. B. Early onset REM sleep. C. An absence of sleep spindles. D. A high percentage of rapid eye movement sleep. Answer: B. Early onset REM sleep. Rationale: one of the diagnostic features of narcolepsy is early onset REM sleep, occurring within 15 minutes of falling asleep. This is abnormal and contributes to the diagnosis. Slow-wave sleep, A, sleep spindles, C, and a high percentage of REM sleep, D, are not specific to narcolepsy. 14. Which of the following is the primary function of orexin in the body? A, to regulate circadian rhythms. B, to promote sleep onset. C, to regulate wakefulness and energy levels. D, to enhance REM sleep. Answer: C, to regulate wakefulness and energy levels. Rationale: orexin plays a critical role in regulating wakefulness and energy levels. In narcolepsy, a deficiency of orexin contributes to the symptoms of excessive daytime sleepiness. Orexin does not primarily regulate circadian rhythms, A, sleep onset, B, or REM sleep, D, though it has some indirect effects on these processes. 15. Which symptom is commonly reported by individuals with narcolepsy during periods of transition between sleep and wakefulness? A. Night sweats. B. Sleep paralysis. C. Snoring. D. Restless legs. Answer: B. Sleep paralysis. Rationale: sleep paralysis is a common symptom experienced by people with narcolepsy when transitioning between sleep and wakefulness. Night sweats, A, snoring, C, and restless legs, D, are not typically associated with narcolepsy and are more common in other sleep disorders such as sleep apnea or restless leg syndrome. 16. Which factor is most commonly associated with the onset of cataplexy in narcolepsy? A. Low blood sugar levels. B. Strong emotional stimuli. C. Prolonged physical activity. D. Sleep deprivation. Answer: B. Strong emotional stimuli. Rationale: cataplexy is most often triggered by strong emotions, such as laughter, anger, or surprise. Low blood sugar, A, physical activity, C, and sleep deprivation, D, can affect narcolepsy, but are not the most common triggers for cataplexy. 17. Which of the following lifestyle changes is important for managing narcolepsy? A. Engaging in vigorous exercise late in the day. B. Practicing good sleep hygiene and taking scheduled naps. C. Avoiding all social interactions. D. Reducing the number of naps during the day. Answer: B. Practicing good sleep hygiene and taking scheduled naps. Rationale: good sleep hygiene, including taking scheduled naps, is essential in managing narcolepsy by regulating the sleep-wake cycle and reducing excessive daytime sleepiness. Vigorous exercise late in the day, A, may worsen sleep problems. Avoiding social interactions, C, is not recommended, and reducing naps, D, can worsen daytime sleepiness. 18. Which of the following conditions can mimic narcolepsy symptoms and should be ruled out during diagnosis? A. Sleep apnea. B. Parkinson's disease. C. Depression. D. Idiopathic hypersomnia. Answer: D. Idiopathic hypersomnia. Rationale: idiopathic hypersomnia shares many symptoms with narcolepsy, such as excessive daytime sleepiness, and should be ruled out during diagnosis. Sleep apnea, A, Parkinson's disease, B, and depression, C, may have overlapping symptoms, but they typically present with additional signs that help differentiate them from narcolepsy. 19. Which of the following is a common side effect of stimulant medications used to treat narcolepsy? A. Insomnia. B. Weight loss. C. Increased appetite. D. Excessive daytime sleepiness. Answer: A. Insomnia. Rationale: stimulant medications like modafinil and methylphenidate may cause insomnia as a side effect due to their wake-promoting properties. Weight loss, B, and increased appetite, C, are less common side effects. Excessive daytime sleepiness, D, would not be a side effect of stimulant medications, as they are used to treat this symptom. 20. Which of the following medications is commonly prescribed to treat excessive daytime sleepiness in narcolepsy? A. Sodium oxybate. B. Methylphenidate. C. Gabapentin.
G. Diazepam.
Answer: B. Methylphenidate. Rationale: methylphenidate, a stimulant, is commonly prescribed to help manage excessive daytime sleepiness in narcolepsy. Sodium oxybate, A, is used for treating cataplexy, not excessive daytime sleepiness. Gabapentin, C, and diazepam, D, are not typically used to treat narcolepsy. 21. What is the role of the Multiple Sleep Latency Test, MSLT, in diagnosing narcolepsy? A, to determine sleep stages during the night. B, to measure the severity of sleep apnea. C, to evaluate how quickly a person falls asleep during the day. D, to measure blood oxygen levels during sleep. Answer: C, to evaluate how quickly a person falls asleep during the day. Rationale: the MSLT is specifically used to evaluate how quickly a person falls asleep during the day and measures the time it takes to enter REM sleep. It is essential in diagnosing narcolepsy. Sleep stages, A, and blood oxygen levels, D, are assessed during polysomnography, and the MSLT is not used to evaluate sleep apnea, B. 22. What is the role of REM sleep in narcolepsy? A, it is typically delayed in narcolepsy. B, it occurs unusually early after sleep onset. C, it is absent in individuals with narcolepsy. D, it is longer in duration in individuals with narcolepsy. Answer: B, it occurs unusually early after sleep onset. Rationale: in narcolepsy, REM sleep occurs abnormally early, typically within 15 minutes of falling asleep. This early onset of REM sleep is a key diagnostic feature of the disorder. REM sleep is not delayed, A, or absent, C, in narcolepsy, and it does not last longer than normal, D. 23. Which of the following comorbid conditions is most commonly associated with narcolepsy? A. Depression. B. Hypertension. C. Obstructive sleep apnea. D. Diabetes mellitus. Answer: A. Depression. Rationale: depression is a common comorbidity in individuals with narcolepsy, likely due to the impact of excessive daytime sleepiness and disrupted sleep patterns. Hypertension, B, obstructive sleep apnea, C, and diabetes mellitus, D, are not typically associated with narcolepsy, though they may coexist in some individuals. 24. Which of the following treatments is used to address both excessive daytime sleepiness and cataplexy in narcolepsy? A. Modafinil. B. Sodium oxybate. C. Stimulants. D. Antidepressants. Answer: B. Sodium oxybate. Rationale: sodium oxybate is effective for managing both excessive daytime sleepiness and cataplexy in narcolepsy. Modafinil, A, is used primarily for excessive daytime sleepiness, while stimulants, C, are also used for this purpose. Antidepressants, D, can help with mood-related symptoms but are not as effective for managing both symptoms. 25. A patient with narcolepsy complains of frequent nighttime awakenings and difficulty staying asleep at night. Which intervention is most likely to help? A. Increasing daytime naps. B. Improving sleep hygiene and establishing a regular bedtime. C. Reducing physical activity. D. Taking sedative medications. Answer: B. Improving sleep hygiene and establishing a regular bedtime. Rationale: good sleep hygiene, including a consistent sleep schedule, can help improve nighttime sleep in individuals with narcolepsy. Daytime naps, A, may contribute to daytime sleepiness, but are not likely to improve nighttime sleep. Reducing physical activity, C, or using sedatives, D, is not recommended, as they can disrupt the overall sleep-wake cycle. 26. What is the underlying cause of narcolepsy in most cases? A. Genetic mutations. B. Brain trauma. C. Orexin deficiency. D. Sleep deprivation. Answer: C. Orexin deficiency. Rationale: in most cases of narcolepsy, there is a deficiency of the neurotransmitter orexin, which plays a key role in regulating wakefulness. Genetic mutations, A, can contribute to this deficiency, but the primary cause is orexin deficiency. Brain trauma, B, and sleep deprivation, D, are not primary causes of narcolepsy. 27. What is the most common age range for the onset of narcolepsy? A. 5 to 10 years old. B. 15 to 30 years old. C. 40 to 60 years old. D. 60 to 80 years old. Answer: B. 15 to 30 years old. Rationale: narcolepsy typically begins in adolescence or early adulthood, with the most common age of onset being between 15 and 30 years old. It is rare for narcolepsy to begin in childhood, A, or older adulthood, C, D. 28. Which of the following is the primary benefit of scheduled naps for people with narcolepsy? A. Reducing the severity of cataplexy. B. Helping to regulate sleep-wake cycles. C. Improving nighttime sleep. D. Enhancing muscle strength. Answer: B. Helping to regulate sleep-wake cycles. Rationale: scheduled naps help to regulate sleep-wake cycles by providing rest during the day and reducing excessive daytime sleepiness. They do not directly affect cataplexy, A, nighttime sleep, C, or muscle strength, D. 29. What is the main symptom of narcolepsy that can be triggered by emotional responses like laughter or anger? A. Insomnia. B. Cataplexy. C. Hypersomnia. D. Sleep paralysis. Answer: B. Cataplexy. Rationale: cataplexy is the sudden loss of muscle tone triggered by strong emotional responses such as laughter or anger. Insomnia, A, hypersomnia, C, and sleep paralysis, D, are also symptoms of narcolepsy but are not specifically triggered by emotional responses. 30. What is one of the most common triggers for narcoleptic episodes during the day? A. Inactivity or boredom. B. Overuse of caffeine. C. Sleeping at night. D. Increased physical exercise. Answer: A. Inactivity or boredom. Rationale: narcoleptic episodes are often triggered by periods of inactivity or boredom, as the body may shift into a sleep-like state due to lack of stimulation. Caffeine, B, may actually worsen sleep issues, and physical exercise, D, does not typically trigger narcolepsy episodes. Sleeping at night, C, is part of a normal sleep pattern and would not trigger an episode. 31. Which of the following is a key characteristic of narcolepsy type 1 with cataplexy? A. Sleep paralysis without excessive daytime sleepiness. B. Sudden loss of muscle tone triggered by emotions. C. Absence of daytime sleepiness. D. Frequent sleepwalking episodes. Answer: B. Sudden loss of muscle tone triggered by emotions. Rationale: narcolepsy type 1 is characterized by cataplexy, which is the sudden loss of muscle tone triggered by strong emotions like laughter or anger. Sleep paralysis, A, is a symptom but not specific to type 1. Absence of daytime sleepiness, C, is not typical, and sleepwalking, D, is unrelated to narcolepsy. 32. Which of the following is a potential side effect of sodium oxybate in narcolepsy treatment? A. Increased appetite. B. Increased daytime sleepiness. C. Nausea and dizziness. D. Weight gain. Answer: C. Nausea and dizziness. Rationale: sodium oxybate is effective for treating narcolepsy, particularly for cataplexy and daytime sleepiness, but it may cause side effects like nausea and dizziness. Increased appetite, A, and weight gain, D, are not typical side effects of this medication. Increased daytime sleepiness, B, would be an inappropriate effect of treatment. 33. What is the role of the hypothalamus in the pathophysiology of narcolepsy? A. It controls muscle tone during sleep. B. It regulates the sleep-wake cycle through orexin. C. It produces melatonin, controlling the sleep cycle. D. It regulates parasympathetic nervous system activity. Answer: B. It regulates the sleep-wake cycle through orexin. Rationale: the The hypothalamus plays a key role in regulating the sleep-wake cycle by producing orexin, which is deficient in narcolepsy. The other functions mentioned are not as relevant to narcolepsy. The hypothalamus does not regulate muscle tone, A, produce melatonin, C, or regulate parasympathetic activity, D, directly in relation to narcolepsy. 34. Which of the following is a typical early warning sign of narcolepsy? A, excessive nighttime wakefulness. B, sudden weight loss. C, frequent and irresistible daytime sleep episodes. D, snoring during sleep. Answer: C, frequent and irresistible daytime sleep episodes. Rationale: a common early symptom of narcolepsy is frequent and uncontrollable daytime sleep episodes. Excessive nighttime wakefulness, A, is not typical in narcolepsy, as it primarily affects daytime wakefulness. Sudden weight loss, B, and snoring, D, are not specific signs of narcolepsy. 35. What is the primary purpose of the multiple sleep latency test, MSLT, in diagnosing narcolepsy? A, to assess sleep stages during overnight sleep. B, to evaluate the degree of excessive daytime sleepiness. C, to determine the presence of sleep apnea. D, to identify abnormalities in heart rate during sleep. Answer: B, to evaluate the degree of excessive daytime sleepiness. Rationale: the MSLT is used to assess how quickly an individual falls asleep during the day and the extent of excessive daytime sleepiness, a hallmark symptom of narcolepsy. It does not assess overnight sleep stages, A, diagnose sleep apnea, C, or measure heart rate, D. 36. Which of the following is true about the relationship between narcolepsy and REM sleep? A, individuals with narcolepsy enter REM sleep later than normal. B, REM sleep is absent in individuals with narcolepsy. C, individuals with narcolepsy enter REM sleep immediately after falling asleep. D, REM sleep is prolonged during the night in narcolepsy. Answer: C, individuals with narcolepsy enter REM sleep immediately after falling asleep. Rationale: one of the key features of narcolepsy is the rapid onset of REM sleep, typically within 15 minutes of falling asleep. REM sleep is not absent, B, or delayed, A, in narcolepsy, and it is not necessarily prolonged, D, during the night. 37. A patient with narcolepsy is instructed to take regular naps during the day. What is the primary reason for this recommendation? A, to increase REM sleep during the day. B, to reduce excessive daytime sleepiness and prevent sleep attacks. C, to improve nighttime sleep quality. D, to treat cataplexy episodes. Answer: B, to reduce excessive daytime sleepiness and prevent sleep attacks. Rationale: scheduled naps help reduce excessive daytime sleepiness and prevent the occurrence of sudden sleep attacks. Naps are not primarily for increasing REM sleep, A, improving nighttime sleep, C, or treating cataplexy, D. 38. Which of the following is a characteristic of narcolepsy that differentiates it from other sleep disorders? A, chronic insomnia. B, sudden and uncontrollable sleep attacks. C, sleepwalking episodes. D, difficulty falling asleep at night. Answer: B, sudden and uncontrollable sleep attacks. Rationale: narcolepsy is characterized by sudden and uncontrollable sleep attacks, a distinguishing feature not seen in other sleep disorders like insomnia, A, or sleepwalking, C. Difficulty falling asleep at night, D, is not a hallmark symptom of narcolepsy. 39. What is a key diagnostic test to assess the presence of excessive daytime sleepiness in narcolepsy? A, polysomnography. B, multiple sleep latency test, MSLT. C, MRI of the brain. D, blood tests for orexin levels. Answer: B, multiple sleep latency test, MSLT. Rationale: the MSLT is a diagnostic test that measures the time it takes for a person to fall asleep during the day, and it is used to assess excessive daytime sleepiness in narcolepsy. Polysomnography, A, is used to assess sleep stages overnight, and MRI, C, or blood tests, D, are not used for diagnosing narcolepsy or assessing daytime sleepiness. 40. Which of the following non-pharmacological interventions is commonly recommended for people with narcolepsy? A. Avoiding all physical activity. B. Avoiding naps during the day. C. Establishing a consistent sleep-wake schedule. D. Reducing daily fluid intake. Answer: C. Establishing a consistent sleep-wake schedule. Rationale: establishing a consistent sleep-wake schedule helps regulate sleep patterns and reduce daytime sleepiness. Avoiding physical activity, A, and naps, B, is not recommended, and reducing fluid intake, D, does not help manage narcolepsy symptoms. 41. What is the primary treatment approach for cataplexy in narcolepsy? A. Stimulants. B. Antidepressants, SSRIs or SNRIs. C. Antipsychotics. D. Anticonvulsants. Answer: B. Antidepressants, SSRIs or SNRIs. Rationale: antidepressants, particularly SSRIs and SNRIs, are commonly used to treat cataplexy because they help regulate mood and the neurological pathways involved in the condition. Stimulants, A, help with daytime sleepiness, but are not effective for cataplexy. Antipsychotics, C, and anticonvulsants, D, are not used as first-line treatments for cataplexy in narcolepsy. 42. Which of the following is an emotional trigger commonly associated with cataplexy in narcolepsy? A. Intense physical exertion. B. Laughter. C. Loud noises. D. Bright lights. Answer: B. Laughter. Rationale: laughter, along with other strong emotions such as surprise, excitement, or anger, can trigger cataplexy in people with narcolepsy. Intense physical exertion, A, loud noises, C, and bright lights, D, are not typical triggers for cataplexy. 43. What type of medication is typically used to treat excessive daytime sleepiness in narcolepsy? A. Stimulants. B. Beta blockers. C. Anticholinergics. D. Non-steroidal anti-inflammatory drugs, NSAIDs. Answer: A. Stimulants. Rationale: stimulants such as modafinil or methylphenidate are the most common medications used to treat excessive daytime sleepiness in narcolepsy. Beta blockers, B, anticholinergics, C, and NSAIDs, D, are not used to treat this symptom of narcolepsy. 44. What is the impact of narcolepsy on social interactions? A. It has little to no impact. B. It can lead to social isolation due to embarrassment about sleep attacks. C. It improves social relationships due to increased sleep quality. D. It decreases overall social activity. Answer: B. It can lead to social isolation due to embarrassment about sleep attacks. Rationale: individuals with narcolepsy may experience social isolation because of embarrassment or fear of having sleep attacks in public. Narcolepsy does not typically improve social relationships, C, or decrease overall social activity, D, though it can certainly challenge social interactions. 45. Which of the following is a common emotional symptom experienced by people with narcolepsy? A. Extreme irritability.
B. Euphoria.
C. Depression. D. Paranoia. Answer: C. Depression. Rationale: depression is a common emotional symptom associated with narcolepsy, likely due to the disruptions in sleep patterns and the impact of excessive daytime sleepiness on daily life. Irritability, A, and euphoria, B, may occur but are not as common as depression. Paranoia, D, is not typically associated with narcolepsy. 46. Which test is most commonly used to rule out other sleep disorders when diagnosing narcolepsy? A. Polysomnography. B. Actigraphy.
C. Home sleep apnea test.
D. Blood pressure monitoring. Answer: A. Polysomnography. Rationale: polysomnography, an overnight sleep study, is used to rule out other sleep disorders such as sleep apnea, and it is often used in combination with the MSLT for diagnosing narcolepsy. Actigraphy, B, home sleep apnea tests, C, and blood pressure monitoring, D, are not used to rule out narcolepsy. 47. How does narcolepsy affect sleep architecture during the night? A. It leads to longer periods of deep sleep. B. It results in a decreased amount of REM sleep. C. REM sleep occurs earlier than in individuals without narcolepsy. D. It causes frequent awakenings throughout the night. Answer: C. REM sleep occurs earlier than in individuals without narcolepsy. Rationale: in narcolepsy, REM sleep occurs much earlier than in individuals without the disorder. This is a characteristic feature of the condition. The other options, including longer deep sleep, A, and reduced REM sleep, B, are not typical of narcolepsy. Frequent awakenings, D, do not generally characterize narcolepsy, which is more associated with daytime sleep attacks. 48. What is the primary goal of treatment for narcolepsy? A. To cure the disorder completely. B. To manage symptoms and improve quality of life. C. To promote long periods of deep sleep. D. To eliminate all naps during the day. Answer: B. To manage symptoms and improve quality of life. Rationale: the main goal of treatment for narcolepsy is to manage symptoms such as excessive daytime sleepiness and cataplexy while improving quality of life. There is currently no cure. A. For narcolepsy. Promoting long periods of deep sleep, C, and eliminating naps, D, are not appropriate treatment goals. 49. What is one of the most significant challenges in diagnosing narcolepsy? A. There are no symptoms associated with the disorder. B. The symptoms overlap with other sleep disorders. C. The disorder is easy to identify with a blood test. D. It requires a specific genetic test. Answer: B. The symptoms overlap with other sleep disorders. Rationale: narcolepsy symptoms, such as excessive daytime sleepiness and cataplexy, overlap with other sleep disorders like sleep apnea and idiopathic hypersomnia. This makes diagnosis challenging. There are no blood tests, C, or specific genetic tests, D, that can definitively diagnose narcolepsy. The disorder is not without symptoms, A, so diagnosis relies on clinical evaluation and tests like the MSLT. 50. Which of the following is a symptom of sleep paralysis commonly associated with narcolepsy? A. Complete paralysis during the day. B. Inability to move when waking up or falling asleep. C. Difficulty falling asleep during the night. D. Short periods of muscle stiffness during sleep. Answer: B. Inability to move when waking up or falling asleep. Rationale: sleep paralysis in narcolepsy is characterized by the inability to move or speak when either waking up or falling asleep, which can be a terrifying experience. It does not involve complete paralysis during the day, A, difficulty falling asleep at night, C, or muscle stiffness during sleep, D. 51. Which of the following medications is commonly prescribed for treating excessive daytime sleepiness in narcolepsy? A. Methylphenidate. B. Clonidine. C. Haloperidol. D. Diazepam. Answer: A. Methylphenidate. Rationale: methylphenidate, a stimulant, is commonly prescribed to treat excessive daytime sleepiness in narcolepsy. Clonidine B and haloperidol C are not used for this purpose, and diazepam D is typically used for anxiety or muscle relaxation, not for daytime sleepiness. 52. Which of the following is a risk factor for developing narcolepsy? A. Chronic lack of sleep. B. Having a family member with narcolepsy. C. High caffeine intake. D. Chronic stress. Answer: B. Having a family member with narcolepsy. Rationale: narcolepsy often has a genetic component, and having a family member with narcolepsy increases the risk of developing the disorder. Chronic lack of sleep, A, high caffeine intake, C, and chronic stress, D, are not direct risk factors for narcolepsy. 53. Which type of narcolepsy is associated with cataplexy? A. Type 1. B. Type 2. C. Idiopathic hypersomnia. D. Obstructive sleep apnea. Answer: A. Type 1. Rationale: narcolepsy type 1 is associated with cataplexy, which involves sudden muscle weakness triggered by emotions. Narcolepsy type 2, B, does not involve cataplexy, and idiopathic hypersomnia, C, and obstructive sleep apnea, D, are distinct disorders that do not typically involve cataplexy. 54. Which of the following is a potential side effect of the stimulant medication used to treat narcolepsy? A. Decreased heart rate. B. Weight gain. C. Insomnia or difficulty sleeping. D. Decreased blood pressure. Answer: C. Insomnia or difficulty sleeping. Rationale: stimulant medications used to treat narcolepsy, such as modafinil or methylphenidate, can cause insomnia or difficulty sleeping, particularly if taken later in the day. Decreased heart rate, A, weight gain, B, and decreased blood pressure, D, are not common side effects of these medications. 55. Which of the following symptoms is most characteristic of narcolepsy with cataplexy? A. Irresistible sleep attacks during the day. B. Sudden loss of muscle tone triggered by emotions. C. Severe insomnia. D. Increased appetite. Answer: B. Sudden loss of muscle tone triggered by emotions. Rationale: a hallmark symptom of narcolepsy with cataplexy is the sudden loss of muscle tone, cataplexy, which is triggered by strong emotions such as laughter or anger. Irresistible sleep attacks, A, are also common in narcolepsy, but they do not specifically identify narcolepsy with cataplexy. Severe insomnia, C, and increased appetite, D, are not characteristic symptoms. 56. What is the primary cause of the sleep attacks in narcolepsy? A. Inability to enter REM sleep. B. Dysfunction in the regulation of the sleep-wake cycle. C. Complete lack of sleep. D. Overproduction of melatonin. Answer: B. Dysfunction in the regulation of the sleep-wake cycle. Rationale: the primary cause of sleep attacks in narcolepsy is dysfunction in the regulation of the sleep-wake cycle, particularly due to a deficiency in the neurotransmitter orexin. Inability to enter REM sleep, A, complete lack of sleep, C, and overproduction of melatonin, D, are not the primary causes of narcolepsy. 57. What is the best method for diagnosing narcolepsy in a patient presenting with excessive daytime sleepiness? A. Clinical interview and physical examination. B. Polysomnography followed by the multiple sleep latency test, MSLT. C. Home sleep test. D. Full blood panel. Answer: B. Polysomnography followed by the multiple sleep latency test, MSLT. Rationale: the gold standard for diagnosing narcolepsy involves conducting polysomnography followed by the MSLT. This combination helps assess both overnight sleep patterns and daytime sleepiness. Clinical examination, A, home sleep tests, C, and blood panels, D, are not sufficient for diagnosing narcolepsy. 58. What is the most appropriate initial treatment for a patient with narcolepsy who presents with excessive daytime sleepiness and sleep attacks? A. Antidepressants. B. Stimulants such as modafinil. C. Benzodiazepines. D. Antipsychotic medication. Answer: B. Stimulants such as modafinil. Rationale: stimulants such as modafinil or methylphenidate are typically prescribed as the first-line treatment for excessive daytime sleepiness and sleep attacks in narcolepsy. Antidepressants, A, benzodiazepines, C, and antipsychotics, D, are not first-line treatments for daytime sleepiness. 59. What is the role of orexin in narcolepsy? A, it regulates the body's response to stress. B, it controls the sleep-wake cycle and promotes wakefulness. C, it helps maintain normal blood sugar levels. D, it regulates the release of melatonin during sleep. Answer: B, it controls the sleep-wake cycle and promotes wakefulness. Rationale: orexin is a neurotransmitter that plays a key role in regulating the sleep-wake cycle and promoting wakefulness. A deficiency in orexin is a key factor in the development of narcolepsy. It does not regulate stress, A, blood sugar, C, or melatonin, D. 60. Which of the following strategies is most effective for managing the sleep attacks associated with narcolepsy? A, avoiding all sleep during the day. B, taking short, scheduled naps. C, practicing relaxation techniques before sleep. D, taking large doses of caffeine throughout the day. Answer: B, taking short, scheduled naps. Rationale: short, scheduled naps during the day can help manage sleep attacks and reduce excessive daytime sleepiness in people with narcolepsy. Avoiding sleep altogether, A, practicing relaxation techniques, C, and taking large doses of caffeine, D, are not effective management strategies for narcolepsy sleep attacks. 61. What is the most common trigger for cataplexy in narcolepsy? A. Physical exhaustion. B. Strong emotions like laughter or anger. C. Sudden changes in environment. D. Lack of sleep during the night. Answer: B. Strong emotions like laughter or anger. Rationale: cataplexy in narcolepsy is commonly triggered by strong emotions, particularly laughter or anger. Physical exhaustion: A. Sudden changes in environment, C. And lack of sleep at night, D. Can affect narcolepsy symptoms but are not typical triggers for cataplexy. 62. Which of the following sleep disorders is most likely to be misdiagnosed as narcolepsy? A. Idiopathic hypersomnia. B. Sleep apnea. C. Restless leg syndrome. D. Insomnia. Answer: A. Idiopathic hypersomnia. Rationale: idiopathic hypersomnia, characterized by excessive daytime sleepiness without the sudden sleep attack seen in narcolepsy, is commonly misdiagnosed as narcolepsy. Sleep apnea, B. Restless leg syndrome, C. And insomnia, D. Have different symptoms and are less likely to be mistaken for narcolepsy. 63. What is the most important aspect of managing narcolepsy in daily life? A. Following a strict diet regimen. B. Engaging in physical exercise regularly. C. Maintaining a regular sleep-wake schedule. D. Avoiding naps altogether. Answer: C. Maintaining a regular sleep-wake schedule. Rationale: maintaining a consistent sleep-wake schedule is essential for managing narcolepsy, as it helps regulate the sleep-wake cycle and reduces symptoms such as excessive daytime sleepiness. A strict diet regimen, A, and regular physical exercise, B, are helpful but not as critical as a consistent sleep schedule. Avoiding naps, D, is not recommended for narcolepsy patients. 64. Which of the following is an important dietary consideration for a person with narcolepsy? A. Eating high-protein meals to induce alertness. B. Reducing caffeine and alcohol intake. C. Increasing carbohydrate intake to promote sleep. D. Following a low-fat, high-sugar diet for energy. Answer: B. Reducing caffeine and alcohol intake. Rationale: reducing caffeine and alcohol intake is important in managing narcolepsy, as these substances can disrupt sleep patterns and worsen symptoms. High-protein meals, A, may help with alertness, but this is not the primary dietary focus. Increasing carbohydrate intake, C, and following a low-fat, high-sugar diet, D, are not appropriate dietary strategies for narcolepsy. 65. What is the main difference between narcolepsy type 1 and type 2? A. Type 1 includes cataplexy, while type 2 does not. B. Type 1 is characterized by excessive daytime sleepiness alone. C. Type 1 involves chronic insomnia. D. Type 1 is associated with sleep apnea. Answer: A. Type 1 includes cataplexy, while type 2 does not. Rationale: the key difference between narcolepsy type 1 and type 2 is the presence of cataplexy in type 1, while type 2 does not include cataplexy. Type 1 does not just involve excessive daytime sleepiness, B, chronic insomnia, C, or sleep apnea, D. 66. Which of the following is a common diagnostic criterion for narcolepsy? A. Nocturnal sleep disturbances. B. Frequent nighttime awakenings. C. Excessive daytime sleepiness lasting for at least 3 months. D. Severe memory loss. Answer: C. Excessive daytime sleepiness lasting for at least 3 months. Rationale: excessive daytime sleepiness lasting for at least 3 months is one of the diagnostic criteria for narcolepsy. Nocturnal sleep disturbances, A, and frequent nighttime awakenings, B, are not specific to narcolepsy, and memory loss, D, is not a defining symptom of the disorder. 67. What is the role of the neurotransmitter orexin in narcolepsy? A. It regulates the release of melatonin. B. It promotes wakefulness and helps regulate the sleep-wake cycle. C. It prevents REM sleep from occurring. D. It enhances deep sleep stages. Answer: B. It promotes wakefulness and helps regulate the sleep-wake cycle. Rationale: Orexin is a neurotransmitter involved in promoting wakefulness and regulating the sleep-wake cycle. It does not regulate melatonin, A, prevent REM sleep, C, or enhance deep sleep stages, D. 68. Which of the following treatments is most effective for managing cataplexy in narcolepsy? A. Stimulants. B. Antidepressants, SSRIs or SNRIs. C. Benzodiazepines. D. Antipsychotics. Answer: B. Antidepressants, SSRIs or SNRIs. Rationale: antidepressants, particularly SSRIs and SNRIs, are often used to manage cataplexy in narcolepsy, as they regulate neurotransmitters involved in cataplexy episodes. Stimulants, A, help with daytime sleepiness, but are not effective for cataplexy. Benzodiazepines, C, and antipsychotics, D, are not first-line treatments for cataplexy. 69. What is the recommended duration for naps for people with narcolepsy to help alleviate daytime sleepiness? A. 10 to 15 minutes. B. 30 to 45 minutes. C. 1 to 2 hours. D. 4 to 5 hours. Answer: A. 10 to 15 minutes. Rationale: short naps of 10 to 15 minutes are recommended for people with narcolepsy to reduce daytime sleepiness without causing sleep inertia. Naps that last 30 to 45 minutes, B, or 1 to 2 hours, C, may lead to grogginess or interfere with nighttime sleep. Naps lasting 4 to 5 hours, D, are too long and not beneficial. 70. Which of the following symptoms is most characteristic of sleep paralysis in narcolepsy? A. Inability to speak when waking up. B. Sudden loss of muscle tone while laughing. C. Frequent waking during the night with vivid dreams. D. Difficulty falling asleep at night. Answer: A. Inability to speak when waking up. Rationale: sleep paralysis in narcolepsy is characterized by the inability to speak or move upon waking, often accompanied by vivid hallucinations. It does not involve muscle tone loss while laughing, B, or difficulty falling asleep, D. Frequent waking and vivid dreams, C, are not typical symptoms of sleep paralysis. 71. Which of the following medications is commonly prescribed to improve alertness in individuals with narcolepsy? A. Methylphenidate. B. Diphenhydramine. C. Lorazepam. D. Ondansetron. Answer: A. Methylphenidate. Rationale: methylphenidate is a stimulant commonly prescribed to improve alertness and reduce daytime sleepiness in narcolepsy. Diphenhydramine, B, and lorazepam, C, are sedatives that would worsen symptoms, while ondansetron, D, is used to treat nausea, not narcolepsy symptoms. 72. How does narcolepsy affect sleep architecture? A. It causes fragmented sleep with frequent awakenings. B. REM sleep occurs early in the sleep cycle. C. Deep sleep is prolonged. D. NREM sleep is absent. Answer: B. REM sleep occurs early in the sleep cycle. Rationale: in narcolepsy, individuals enter REM sleep very quickly, often within 15 minutes of falling asleep, which is a hallmark of the disorder. Fragmented sleep with frequent awakenings, A, and prolonged deep sleep, C, are not typical of narcolepsy. NREM sleep is not absent, D, but REM sleep occurs abnormally early. 73. Which of the following is a key emotional impact of narcolepsy on individuals? A. Increased anxiety. B. Heightened sense of euphoria. C. Feelings of embarrassment due to sleep attacks. D. Reduced emotional regulation. Answer: C. Feelings of embarrassment due to sleep attacks. Rationale: individuals with narcolepsy often experience embarrassment due to the unpredictability of sleep attacks, which can occur in public or social situations. Increased anxiety, A, may occur, but it is not as common as embarrassment. Narcolepsy does not typically result in heightened euphoria, B, or reduced emotional regulation, D. 74. What is the most effective way to prevent sleep attacks during the day in individuals with narcolepsy? A. Practicing deep breathing exercises. B. Taking short, scheduled naps throughout the day. C. Reducing fluid intake. D. Engaging in vigorous physical activity. Answer: B. Taking short, scheduled naps throughout the day. Rationale: short, scheduled naps throughout the day can effectively help manage excessive daytime sleepiness and prevent sleep attacks in individuals with narcolepsy. Deep breathing exercises may reduce stress, but do not address the root cause. Reducing fluid intake and engaging in vigorous physical activity are not recommended strategies for managing daytime sleep attacks. 75. Which of the following is a common comorbidity seen in individuals with narcolepsy? A. Hypertension. B. Depression. C. Type 2 diabetes. D. Osteoarthritis. Answer: B. Depression. Rationale: depression is a common comorbidity in individuals with narcolepsy, likely due to the impact of the disorder on sleep patterns and quality of life. Hypertension, A. Type 2 diabetes, C. and osteoarthritis, D. are not commonly associated with narcolepsy. 76. What is the role of a multiple sleep latency test, MSLT, in diagnosing narcolepsy? A. To assess how much REM sleep is achieved at night. B. To measure daytime sleepiness and determine the presence of sleep attacks. C. To determine the stages of sleep during the night. D. To measure the production of orexin. Answer: B. To measure daytime sleepiness and determine the presence of sleep attacks. Rationale: the MSLT measures daytime sleepiness and the occurrence of sleep attacks. It is commonly used in diagnosing narcolepsy. It does not assess REM sleep, A. Determine sleep stages, C. or measure orexin levels, D. 77. Which of the following is not a typical feature of narcolepsy? A. Excessive daytime sleepiness. B. Sudden muscle weakness during strong emotions, cataplexy. C. Frequent and prolonged sleep apnea episodes. D. Vivid dreams and hallucinations upon waking. Answer: C. Frequent and prolonged sleep apnea episodes. Rationale: sleep apnea is not a typical feature of narcolepsy. Narcolepsy is characterized by excessive daytime sleepiness, A. Cataplexy, B. and vivid dreams or hallucinations, D. upon waking, but sleep apnea, C. is a separate disorder. 78. Which of the following symptoms can occur immediately upon waking in individuals with narcolepsy? A. Sleep paralysis. B. Muscle rigidity. C. Acute pain. D. Loss of appetite. Answer: A. Sleep paralysis. Rationale: sleep paralysis is a common symptom that can occur immediately upon waking in individuals with narcolepsy. Muscle rigidity, B. Acute pain, C. and loss of appetite, D. are not common immediate symptoms of narcolepsy. 79. Which of the following medications is used to help reduce symptoms of cataplexy in narcolepsy? A. Modafinil. B. Sodium oxybate. C. Methylphenidate. D. Trazodone. Answer: B. Sodium oxybate. Rationale: sodium oxybate is the most effective medication for managing cataplexy in narcolepsy. Modafinil, A. and methylphenidate, C. are used for excessive daytime sleepiness, but are not effective for cataplexy. Trazodone, D. is primarily used for sleep disorders, but not for managing cataplexy. 80. What is the primary mechanism of action of modafinil, a common medication used in treating narcolepsy? A. It increases the release of serotonin. B. It stimulates the release of orexin. C. It promotes wakefulness by affecting dopamine levels. D. It inhibits GABA receptors. Answer: C. It promotes wakefulness by affecting dopamine levels. Rationale: modafinil promotes wakefulness by affecting dopamine and other neurotransmitters in the brain, which helps reduce excessive daytime sleepiness in narcolepsy. It does not primarily affect serotonin, A, orexin, B, or GABA receptors, D. 81. What is the impact of narcolepsy on a person's social and work life? A. It usually enhances social interactions. B. It can cause significant disruptions in daily activities and relationships. C. It has no impact on work performance. D. It makes the person more productive at work. Answer: B. It can cause significant disruptions in daily activities and relationships. Rationale: Narcolepsy can significantly disrupt a person's daily activities, work performance, and relationships due to the unpredictability of sleep attacks and other symptoms. It does not usually enhance social interactions, A, or improve productivity, D. 82. What is the most important lifestyle modification for individuals with narcolepsy? A. Maintaining a regular sleep schedule. B. Increasing daily physical exertion. C. Reducing screen time before bed. D. Following a low-carbohydrate diet. Answer: A. Maintaining a regular sleep schedule. Rationale: maintaining a regular sleep schedule is one of the most important lifestyle modifications for managing narcolepsy, as it helps regulate the sleep-wake cycle. Increasing physical activity, B. Reducing screen time, C. And following a low-carbohydrate diet, D. are secondary strategies that may help, but are not as critical. 83. Which of the following is most commonly used to treat the excessive daytime sleepiness associated with narcolepsy? A. Antidepressants. B. Stimulants. C. Benzodiazepines. D. Sedating antihistamines. Answer: B. Stimulants. Rationale: stimulants, such as modafinil and methylphenidate, are commonly prescribed to treat excessive daytime sleepiness in narcolepsy. Antidepressants, A, and benzodiazepines, C, are not used for daytime sleepiness, and sedating antihistamines, D, are not appropriate for narcolepsy. 84. What is a common emotional symptom experienced by people with narcolepsy? A. Excessive fear of sleep. B. Euphoria after sleep attacks. C. Depression and anxiety. D. Heightened sense of focus and concentration. Answer: C. Depression and anxiety. Rationale: people with narcolepsy often experience depression and anxiety due to the impact of the disorder on their quality of life. Excessive fear of sleep, A. Euphoria after sleep attacks, B. And heightened focus, D. are not common emotional symptoms associated with narcolepsy. 85. Which of the following is a common symptom of narcolepsy that affects sleep onset? A. Insomnia. B. Difficulty transitioning from wakefulness to sleep. C. Sleepwalking. D. Night terrors. Answer: B. Difficulty transitioning from wakefulness to sleep. Rationale: individuals with narcolepsy often have difficulty transitioning from wakefulness to sleep, which can lead to sleep attacks. Insomnia, A. Sleepwalking, C. and night terrors, D. are not common symptoms of narcolepsy. 86. What does a diagnosis of narcolepsy typically require in terms of testing? A. A sleep diary and a physical examination. B. Polysomnography followed by a multiple sleep latency test, MSLT. C. A lumbar puncture to test cerebrospinal fluid. D. A CT scan of the brain. Answer: B. Polysomnography followed by a multiple sleep latency test, MSLT. Rationale: polysomnography followed by the MSLT is the gold standard for diagnosing narcolepsy. A sleep diary and physical examination, A, may assist in the diagnosis, but testing is needed. A lumbar puncture, C, and CT scan, D, are not necessary for diagnosing narcolepsy. 87. What is the effect of narcolepsy on sleep architecture at night? A. Decreased amount of REM sleep. B. Increased amount of deep sleep. C. Frequent nighttime awakenings. D. Early onset of REM sleep. Answer: D. Early onset of REM sleep. Rationale: in narcolepsy, REM sleep occurs earlier than in people without the disorder, typically within 15 minutes of falling asleep. This is a hallmark feature of narcolepsy. Decreased REM sleep, A, increased deep sleep, B, and frequent awakenings, C, are not characteristic of narcolepsy. 88. What is a common coexisting disorder with narcolepsy that can affect sleep? A. Restless leg syndrome. B. Asthma. C. Chronic pain syndrome. D. Fibromyalgia. Answer: A. Restless leg syndrome. Rationale: restless leg syndrome is often comorbid with narcolepsy and can exacerbate sleep disturbances. Asthma, B. Chronic pain syndrome, C. and fibromyalgia, D. are not commonly associated with narcolepsy in the same way. 89. Which of the following is not a hallmark symptom of narcolepsy with cataplexy? A. Sudden loss of muscle tone triggered by emotions. B. Frequent episodes of sleep paralysis. C. Excessive daytime sleepiness. D. Severe insomnia at night. Answer: D. Severe insomnia at night. Rationale: severe insomnia at night is not a hallmark symptom of narcolepsy with cataplexy, which typically involves excessive daytime sleepiness, cataplexy, and sleep paralysis, A and B. Insomnia is not commonly associated with narcolepsy, as most patients sleep well at night. 90. What neurotransmitter is most associated with the development of narcolepsy? A. Serotonin. B. Dopamine. C. Orexin. D. GABA. Answer: C. Orexin. Rationale: orexin, also known as hypocretin, is a neurotransmitter involved in regulating wakefulness and the sleep-wake cycle, and its deficiency is strongly associated with narcolepsy. Serotonin, A, dopamine, B, and GABA, D, are involved in other aspects of sleep and mood regulation but are not primarily associated with narcolepsy. 91. Which of the following is a typical feature of sleep attacks in narcolepsy? A. They occur only during the night. B. They happen suddenly during any part of the day. C. They happen after a full night's sleep only. D. They are always preceded by deep sleep. Answer: B. They happen suddenly during any part of the day. Rationale: sleep attacks in narcolepsy occur suddenly, often during the day, regardless of whether the person has had enough sleep. They are not restricted to nighttime or preceded by deep sleep. 92. What is one of the primary treatments for managing excessive daytime sleepiness in narcolepsy? A. Cognitive behavioral therapy, CBT. B. Stimulants such as modafinil. C. Antipsychotic medications. D. Antihistamines. Answer: B. Stimulants such as modafinil. Rationale: stimulants such as modafinil are the primary treatments for managing excessive daytime sleepiness in narcolepsy. Cognitive behavioral therapy, A, can help with coping strategies, but is not the primary treatment. Antipsychotic medications, C, and antihistamines, D, are not effective for the symptom. 93. What psychological symptom is common in individuals with narcolepsy? A. Increased memory capacity. B. Fear of falling asleep in public. C. Overconfidence in sleep ability. D. Mood swings and irritability. Answer: B. Fear of falling asleep in public. Rationale: individuals with narcolepsy often experience fear of falling asleep in public due to the unpredictability of sleep attacks, leading to anxiety and embarrassment. Memory issues, A, and mood swings, D, can occur but are not as common as the fear of sleep attacks in social settings. Overconfidence in sleep ability, C, is not a typical symptom. 94. Which of the following is true regarding narcolepsy's effect on a person's ability to maintain focus during the day? A. Narcolepsy typically enhances focus and alertness. B. Individuals with narcolepsy often experience difficulty maintaining focus. C. Narcolepsy has no impact on focus and attention. D. Narcolepsy only affects physical performance, not mental focus. Answer: B. Individuals with narcolepsy often experience difficulty maintaining focus. Rationale: individuals with narcolepsy often have difficulty maintaining focus due to excessive daytime sleepiness and sleep attacks. It does not enhance focus, A, or have no impact on attention, C. Narcolepsy can affect both physical and mental performance, D. 95. How does the presence of cataplexy in narcolepsy affect a person's quality of life? A. It has no impact on daily life. B. It can cause significant embarrassment and impair functioning. C. It enhances the person's social interactions. D. It results in longer periods of sleep during the day. Answer: B. It can cause significant embarrassment and impair functioning. Rationale: cataplexy can cause sudden loss of muscle tone, often triggered by strong emotions, which can lead to embarrassment and impairment in daily activities. It does not have no impact, A, or enhance social interactions, C. Cataplexy does not cause longer sleep periods, D. 96. What is the typical age of onset for narcolepsy? A. In infancy. B. Between ages 10 and 25. C. After age 50. D. Between ages 30 and 40. Answer: B. Between ages 10 and 25. Rationale: narcolepsy typically begins between the ages of 10 and 25, though symptoms can appear earlier or later. It is not typically seen in infancy, A. After age 50, C. Or between ages 30 and 40, D. 97. What is a characteristic feature of the hallucinations that individuals with narcolepsy may experience during sleep paralysis? A. They are vivid and often terrifying. B. They are always pleasant and calming. C. They occur exclusively during the night. D. They are associated with sleepwalking. Answer: A. They are vivid and often terrifying. Rationale: hallucinations that occur during sleep paralysis in narcolepsy are often vivid and can be frightening. They are not typically pleasant, B. Or exclusively nocturnal, C. Nor are they associated with sleepwalking, D. 98. Which of the following best describes the primary cause of narcolepsy? A. A viral infection that damages the brain. B. A genetic mutation that results in the loss of orexin-producing neurons. C. A blockage of the upper airway during sleep. D. Poor sleep hygiene. Answer: B. A genetic mutation that results in the loss of orexin-producing neurons. Rationale: narcolepsy is primarily caused by a genetic mutation that leads to the loss of orexin-producing neurons in the brain, which helps regulate wakefulness. A viral infection, A. Airway blockage, C. And poor sleep hygiene, D. Are not the primary causes of narcolepsy. 99. Which of the following is the first-line treatment for excessive daytime sleepiness in individuals with narcolepsy? A. Modafinil. B. Sodium oxybate. C. Benzodiazepines. D. Corticosteroids. Answer: A. Modafinil. Rationale: modafinil is the first-line treatment for excessive daytime sleepiness in narcolepsy. Sodium oxybate, B, is used for cataplexy, but modafinil is preferred for daytime sleepiness. Benzodiazepines, C, and corticosteroids, D, are not used for narcolepsy. 100. What is the purpose of a sleep diary in the evaluation of narcolepsy? A. To track the frequency and timing of sleep attacks. B. To document specific emotions that trigger cataplexy. C. To measure REM sleep stages. D. To identify underlying medical conditions unrelated to sleep. Answer: A. To track the frequency and timing of sleep attacks. Rationale: a sleep diary is helpful in tracking the frequency, timing, and duration of sleep attacks, which is crucial for diagnosing narcolepsy. It does not specifically document emotions, B, REM sleep stages, C, or unrelated medical conditions, D. 101. What is a potential complication of untreated narcolepsy? A. Obesity. B. Increased risk of car accidents. C. Osteoporosis. D. Chronic fatigue syndrome. Answer: B. Increased risk of car accidents. Rationale: untreated narcolepsy can lead to an increased risk of car accidents due to sudden sleep attacks while driving. Obesity, A. Osteoporosis, C. And chronic fatigue syndrome, D. Are not direct complications of untreated narcolepsy. 102. Which of the following is an essential component of cognitive behavioral therapy, CBT, for narcolepsy? A. Developing strategies to avoid sleep entirely. B. Learning to manage daytime sleepiness with scheduled naps. C. Reducing the amount of sleep at night. D. Engaging in relaxation techniques before sleep. Answer: B. Learning to manage daytime sleepiness with scheduled naps. Rationale: CBT for narcolepsy focuses on helping individuals manage daytime sleepiness, which includes scheduled naps and other strategies to improve wakefulness. Avoiding sleep, A, and reducing nighttime sleep, C, are not helpful. Relaxation techniques, D, may be beneficial, but are not the primary focus of CBT for narcolepsy. 103. What is the role of lifestyle modifications in the treatment of narcolepsy? A. They are the primary treatment for narcolepsy. B. They help improve symptoms but are not sufficient alone. C. They are unnecessary and should be avoided. D. They eliminate the need for pharmacological treatments. Answer. B. They help improve symptoms, but are not sufficient alone. Rationale. Lifestyle modifications, such as maintaining a regular sleep-wake schedule, are helpful in managing narcolepsy symptoms, but are not sufficient without pharmacological treatments. They are not the primary treatment, A, and do not eliminate the need for medication, D. 104. Which of the following medications is prescribed for narcolepsy to help with muscle weakness and paralysis caused by cataplexy? A. Sodium oxybate. B. Dextroamphetamine. C. Lithium.
D. Clozapine.
Answer. A. Sodium oxybate. Rationale. Sodium oxybate is used to treat muscle weakness and paralysis associated with cataplexy in narcolepsy. Dextroamphetamine, B, lithium, C, and clozapine, D, are not used for this purpose. 105. How does narcolepsy affect REM sleep cycles? A. It causes REM sleep to occur later in the sleep cycle. B. It results in an inability to enter REM sleep. C. It causes the person to enter REM sleep very quickly after falling asleep. D. It lengthens the duration of REM sleep. Answer. C. It causes the person to enter REM sleep very quickly after falling asleep. Rationale. Narcolepsy causes individuals to enter REM sleep very quickly, often within minutes of falling asleep. This is a characteristic feature of the disorder. REM sleep does not occur later. A. Nor is there an inability to enter REM. B. Or prolonged REM sleep. D. 106. Which of the following is a key consideration when prescribing stimulant medications for narcolepsy? A. They can be addictive and require careful monitoring. B. They are best taken at bedtime. C. They increase the risk of sleepwalking. D. They are contraindicated for individuals with anxiety. Answer. A. They can be addictive and require careful monitoring. Rationale. Stimulant medications, such as modafinil and methylphenidate, can be addictive and should be carefully monitored for side effects. They are not taken at bedtime, B, and do not increase the risk of sleepwalking, C. They may be used with caution in individuals with anxiety, D, but it is not a strict contraindication. 107. Which of the following is true regarding the relationship between narcolepsy and sleep apnea? A. Narcolepsy and sleep apnea are the same condition. B. Narcolepsy may coexist with sleep apnea, but they are distinct conditions. C. Sleep apnea always causes narcolepsy. D. Narcolepsy prevents the development of sleep apnea. Answer. B. Narcolepsy may coexist with sleep apnea, but they are distinct conditions. Rationale. Narcolepsy and sleep apnea are distinct conditions, but can coexist in some individuals. They are not the same condition, A, and sleep apnea does not cause narcolepsy, C. Narcolepsy does not prevent sleep apnea, D. 108. What is the typical course of treatment for cataplexy in narcolepsy? A. Sleep hygiene improvements. B. Antidepressants and sodium oxybate. C. Antipsychotics and benzodiazepines. D. Cognitive behavioral therapy, CBT, alone. Answer. B. Antidepressants and sodium oxybate. Rationale. The treatment for cataplexy often includes antidepressants, which affect serotonin and norepinephrine, and sodium oxybate. Sleep hygiene improvements, A, alone are not sufficient, and antipsychotics, C, and CBT, D, are not primary treatments for cataplexy. 109. How can the sleep paralysis associated with narcolepsy affect an individual's mental health? A. It leads to frequent episodes of depression. B. It can cause anxiety and fear around sleep. C. It improves emotional stability. D. It has no impact on mental health. Answer. B. It can cause anxiety and fear around sleep. Rationale. Sleep paralysis, which is often accompanied by hallucinations, can cause anxiety and fear around sleep. It does not necessarily lead to depression, A, nor does it improve emotional stability, C, or have no impact on mental health, D. 110. What is the effect of narcolepsy on sleep architecture during the night? A. It leads to fragmented sleep. B. It results in prolonged periods of deep sleep. C. It causes a delay in the onset of sleep. D. It causes increased wakefulness during the night. Answer. A. It leads to fragmented sleep. Rationale: narcolepsy can lead to fragmented sleep, with frequent awakenings and early onset of REM sleep. Prolonged deep sleep, B. Sleep onset delay, C. And increased wakefulness during the night, D. Are not characteristic of narcolepsy. 111. Which of the following diagnostic tests is most commonly used to confirm narcolepsy? A. Electroencephalogram, EEG. B. Polysomnography, PSG, followed by a multiple sleep latency test, MSLT. C. CT scan of the brain. D. MRI of the brain. Answer: B. Polysomnography, PSG, followed by a multiple sleep latency test, MSLT. Rationale: polysomnography, PSG, and a multiple sleep latency test, MSLT, are the standard diagnostic tools for narcolepsy. EEG, A, is useful for other neurological conditions, while CT and MRI, C, D, are not specific for diagnosing narcolepsy. 112. Which symptom of narcolepsy is most likely to occur during periods of emotional excitement or stress? A. Sleep paralysis. B. Cataplexy. C. Hallucinations. D. Insomnia. Answer: B. Cataplexy. Rationale: cataplexy is triggered by strong emotions, such as excitement or stress, and involves sudden muscle weakness or paralysis. Sleep paralysis, A, occurs during transitions between sleep and wakefulness. Hallucinations, C, occur during sleep transitions, and insomnia, D, is not a typical symptom of narcolepsy. 113. What is the role of orexin in narcolepsy? A, it regulates sleep-wake cycles and promotes wakefulness. B, it induces REM sleep. C, it regulates the body's circadian rhythm. D, it suppresses the desire for sleep. Answer: A, it regulates sleep-wake cycles and promotes wakefulness. Rationale: orexin is a neurotransmitter that regulates the sleep-wake cycle and promotes wakefulness. A deficiency of orexin in the brain is a key factor in narcolepsy. It does not directly induce REM sleep, B, regulate the circadian rhythm, C, or suppress the desire for sleep, D. 114. What is the purpose of scheduled naps in the management of narcolepsy? A, they help reduce excessive sleep during the night. B, they improve alertness and reduce daytime sleepiness. C, they are used to induce REM sleep. D, they are recommended to avoid the use of medications. Answer: B, they improve alertness and reduce daytime sleepiness. Rationale: scheduled naps are an important part of narcolepsy management as they help alleviate daytime sleepiness and improve alertness. Naps are not intended to reduce nighttime sleep, A, or induce REM sleep, C. They do not replace medications, D. 115. Which of the following is a key feature of sleep paralysis in narcolepsy? A, inability to speak or move while awake. B, it occurs only during REM sleep. C, it leads to temporary episodes of total muscle paralysis. D, it happens when the person is not dreaming. Answer: C, it leads to temporary episodes of total muscle paralysis. Rationale: sleep paralysis in narcolepsy involves temporary episodes of muscle paralysis during transitions between sleep and wakefulness. It is not associated with an inability to speak while awake, A, or restricted to REM sleep, B, and it can occur during any part of the sleep cycle, D. 116. Which of the following conditions can sometimes be mistaken for narcolepsy due to similar symptoms of excessive daytime sleepiness? A, idiopathic hypersomnia. B, sleep apnea. C, restless leg syndrome. D, insomnia. Answer: A, idiopathic hypersomnia. Rationale: idiopathic hypersomnia presents with excessive daytime sleepiness similar to narcolepsy, but does not involve cataplexy, sleep paralysis, or hallucinations. Sleep apnea, B, restless leg syndrome, C, and insomnia, D, can cause daytime fatigue but have distinct symptoms. 117. Which neurotransmitter is most significantly affected in individuals with narcolepsy? A, dopamine. B, serotonin. C, norepinephrine. D, orexin. Answer: D, orexin. Rationale: The primary neurotransmitter affected in narcolepsy is orexin, which regulates wakefulness. Dopamine A, serotonin B, and norepinephrine C are also involved in sleep regulation, but orexin deficiency is the hallmark of narcolepsy. 118. Which of the following is an example of a non-pharmacological approach to managing narcolepsy? A. Use of stimulant medications. B. Behavioral modifications and cognitive behavioral therapy, CBT. C. Scheduled use of sleeping pills. D. Use of antidepressants. Answer. B. Behavioral modifications and cognitive behavioral therapy, CBT. Rationale. Behavioral modifications and cognitive behavioral therapy, CBT, are used to help individuals with narcolepsy manage symptoms such as daytime sleepiness. Stimulants, A, and antidepressants, D, are pharmacological treatments, and sleeping pills, C, are not recommended for narcolepsy management. 119. What is the role of modafinil in the treatment of narcolepsy? A. It treats cataplexy. B. It promotes wakefulness and reduces daytime sleepiness. C. It is used to treat sleep paralysis. D. It improves the quality of nighttime sleep. Answer. B. It promotes wakefulness and reduces daytime sleepiness. Rationale. Modafinil is a wakefulness-promoting agent commonly used to treat excessive daytime sleepiness in narcolepsy. It does not treat cataplexy, A, sleep paralysis, C, or nighttime sleep quality, D. 120. What effect can narcolepsy have on an individual's social life? A. It has no impact on social interactions. B. It may cause embarrassment due to sudden sleep attacks or cataplexy. C. It improves social engagement due to increased alertness. D. It makes it easier for individuals to stay awake during social events. Answer. B. It may cause embarrassment due to sudden sleep attacks or cataplexy. Rationale. Narcolepsy can affect social life by causing embarrassment, particularly due to sudden sleep attacks or episodes of cataplexy. It does not improve social engagement, C, or make staying awake easier, D, and it can have a significant impact on social interactions, A. 121. Which of the following is the primary goal of treatment in narcolepsy? A. To completely eliminate all symptoms. B. To improve quality of life by managing symptoms. C. To cure the disorder. D. To prevent the need for sleep altogether. Answer. B. To improve quality of life by managing symptoms. Rationale. The primary goal in treating narcolepsy is to improve the patient's quality of life by managing symptoms such as excessive daytime sleepiness, cataplexy, and sleep paralysis. It is not a cure, C, nor does it aim to completely eliminate symptoms, A, or prevent sleep, D. 122. What is the most common cause of excessive daytime sleepiness in narcolepsy? A. Poor sleep hygiene. B. The disruption of normal sleep-wake cycles. C. Chronic insomnia. D. Depression. Answer. B. The disruption of normal sleep-wake cycles. Rationale. The primary cause of excessive daytime sleepiness in narcolepsy is the disruption of normal sleep-wake cycles due to the early onset of REM sleep. Poor sleep hygiene, A. Chronic insomnia, C, and depression, D, can contribute to sleep problems, but they are not the main cause of excessive sleepiness in narcolepsy. 123. Which of the following is a recommended behavioral strategy to help manage narcolepsy symptoms? A. Limiting naps to 1 per day. B. Napping at irregular times throughout the day. C. Keeping a regular sleep-wake schedule. D. Avoiding all caffeine consumption. Answer. C. Keeping a regular sleep-wake schedule. Rationale. Keeping a regular sleep-wake schedule is important for managing narcolepsy symptoms. Limiting naps to 1 per day, A, and avoiding caffeine, D, may be helpful, but maintaining a consistent sleep-wake routine, C, is key. Napping at irregular times, B, is not recommended. 124. Which of the following is true about the genetic component of narcolepsy? A. Narcolepsy is always inherited. B. Narcolepsy may have a genetic predisposition, but not all cases are inherited. C. It is caused exclusively by environmental factors. D. Narcolepsy is caused by a single gene mutation. Answer: B. Narcolepsy may have a genetic predisposition, but not all cases are inherited. Rationale: narcolepsy may have a genetic component, but it is not always inherited. Environmental factors also play a role. It is not exclusively caused by environmental factors, C, or a single gene mutation, D. 125. What type of sleep pattern is most characteristic of narcolepsy? A. Uninterrupted deep sleep. B. Prolonged periods of light sleep. C. Frequent transitions between wakefulness and REM sleep. D. Excessive REM sleep throughout the night. Answer: C. Frequent transitions between wakefulness and REM sleep. Rationale: narcolepsy is characterized by frequent transitions between wakefulness and REM sleep, often occurring shortly after falling asleep. Uninterrupted deep sleep, A, and prolonged light sleep, B, are not characteristic of narcolepsy. Excessive REM sleep throughout the night, D, also does not define narcolepsy. 126. Which of the following is a hallmark symptom of narcolepsy that distinguishes it from other sleep disorders? A. Insomnia. B. Sudden, uncontrollable sleep attacks during the day. C. Restless leg syndrome. D. Chronic fatigue. Answer: B. Sudden, uncontrollable sleep attacks during the day. Rationale: the hallmark symptom of narcolepsy is sudden, uncontrollable sleep attacks during the day. This is distinct from insomnia, A, restless leg syndrome, C, and chronic fatigue, D. 127. Which of the following is commonly prescribed to help reduce symptoms of cataplexy in narcolepsy? A. Modafinil. B. Sodium oxybate. C. Stimulants. D. Antidepressants. Answer: B. Sodium oxybate. Rationale: sodium oxybate is commonly prescribed to help reduce symptoms of cataplexy in narcolepsy. Modafinil, A, is used for excessive daytime sleepiness, while stimulants, C, and antidepressants, D, are not typically used for treating cataplexy. 128. What does a sleep study, polysomnography, help to determine in patients suspected of having narcolepsy? A. The amount of deep sleep during the night. B. The presence of REM sleep during the night. C. The patterns of sleep-wake transitions and REM sleep onset. D. The total sleep duration per night. Answer: C. The patterns of sleep-wake transitions and REM sleep onset. Rationale: polysomnography helps to evaluate sleep-wake transitions and the onset of REM sleep, which is altered in narcolepsy. It does not primarily focus on deep sleep, A, total sleep duration, D, or the presence of REM sleep, B. 129. Which of the following treatments is considered the first line for managing excessive daytime sleepiness in narcolepsy? A. Modafinil. B. Sodium oxybate. C. Stimulants, e.g., amphetamines. D. Antidepressants. Answer: A. Modafinil. Rationale: modafinil is the first-line treatment for excessive daytime sleepiness in narcolepsy due to its wakefulness-promoting effects. Sodium oxybate, B, and stimulants, C, are used for other symptoms such as cataplexy, while antidepressants, D, are not typically used as first-line treatments. 130. What is the main cause of cataplexy in narcolepsy? A. Sudden, intense emotions. B. Lack of sleep. C. Sleepwalking. D. Irregular sleep patterns. Answer: A. Sudden, intense emotions. Rationale: cataplexy in narcolepsy is triggered by sudden, intense emotions such as laughter, surprise, or excitement. It is not caused by lack of sleep, B, sleepwalking, C, or irregular sleep patterns, D. 131. Which of the following is the primary neurotransmitter involved in the development of narcolepsy? A. Serotonin. B. Dopamine. C. Orexin. D. Acetylcholine. Answer: C. Orexin. Rationale: orexin is the primary neurotransmitter involved in narcolepsy as it regulates wakefulness. Deficiency of orexin is a major cause of narcolepsy. Serotonin, A, dopamine, B, and acetylcholine, D, also play roles in sleep regulation but are not the primary cause of narcolepsy. 132. Which of the following is a common non-pharmacological approach to managing narcolepsy? A. Napping regularly during the day. B. Avoiding naps entirely. C. Sleeping for 10 to 12 hours at night. D. Exercising vigorously before bed. Answer: A. Napping regularly during the day. Rationale: regular naps during the day can help reduce daytime sleepiness in individuals with narcolepsy. Avoiding naps, B, and sleeping excessively at night, C, are not recommended. Exercising vigorously before bed, D, may interfere with sleep quality. 133. Which of the following medications is prescribed to promote wakefulness in patients with narcolepsy? A. Modafinil. B. Lithium.
C. Morphine.
D. Clonazepam. Answer: A. Modafinil. Rationale: modafinil is a wakefulness-promoting medication commonly used to treat excessive daytime sleepiness in narcolepsy. Lithium, B, morphine, C, and clonazepam, D, are not used for this purpose. 134. Which of the following is an essential component of cognitive behavioral therapy, CBT, for individuals with narcolepsy? A. Identifying emotional triggers for sleep attacks. B. Using relaxation techniques before sleep. C. Developing a consistent sleep-wake schedule. D. Avoiding naps during the day. Answer: C. Developing a consistent sleep-wake schedule. Rationale: CBT for narcolepsy focuses on developing a consistent sleep-wake schedule to manage daytime sleepiness and other symptoms. Identifying emotional triggers, A, and relaxation techniques, B, are helpful, but the primary goal is maintaining a consistent sleep schedule. Napping is not strictly avoided, D. 135. Which of the following best describes the sleep pattern of an individual with narcolepsy? A. They sleep for long, uninterrupted periods at night. B. They enter REM sleep shortly after falling asleep. C. They experience frequent awakenings during the night. D. They have prolonged periods of deep sleep. Answer: B. They enter REM sleep shortly after falling asleep. Rationale: in narcolepsy, individuals often enter REM sleep very quickly after falling asleep, which disrupts the normal sleep cycle. They do not typically have long, uninterrupted sleep, A, or prolonged periods of deep sleep, D, and frequent awakenings are not characteristic, C. 136. Which of the following symptoms occurs most often during episodes of sleep paralysis in narcolepsy? A. Hallucinations. B. Loss of consciousness. C. Excessive daytime sleepiness. D. Sudden, uncontrollable sleep attacks. Answer: A. Hallucinations. Rationale: hallucinations are a common symptom that occurs during episodes of sleep paralysis in narcolepsy. Loss of consciousness, B, does not occur, and excessive daytime sleepiness, C, is a primary symptom but not specific to sleep paralysis. Sudden sleep attacks, D, occur separately from sleep paralysis. 137. Which of the following is a characteristic feature of the hallucinations experienced by people with narcolepsy? A. They occur during sleep transitions and can be vivid. B. They are always pleasant and comforting. C. They only occur during the night. D. They cause loss of consciousness. Answer: A. They occur during sleep transitions and can be vivid. Rationale: hallucinations in narcolepsy typically occur during transitions between sleep and wakefulness and can be vivid or terrifying. They are not always pleasant, B, occur at other times besides the night, C, and do not involve loss of consciousness, D. 138. Which of the following is an example of a condition that may mimic narcolepsy? A. Idiopathic hypersomnia. B. Sleep apnea. C. Restless leg syndrome. D. Insomnia. Answer: A. Idiopathic hypersomnia. Rationale: idiopathic hypersomnia can present with excessive daytime sleepiness similar to narcolepsy, but lacks other hallmark symptoms, such as cataplexy. Sleep apnea, B, restless leg syndrome, C, and insomnia, D, can cause daytime fatigue, but have different underlying causes. 139. What is the most significant side effect of stimulant medications used to treat narcolepsy? A. Dehydration. B. Increased heart rate and blood pressure. C. Insomnia. D. Weight gain. Answer: B. Increased heart rate and blood pressure. Rationale: Stimulant medications, such as modafinil or amphetamines, can lead to increased heart rate and blood pressure as side effects. Dehydration, A, insomnia, C, and weight gain, D, are not the most significant side effects. 140. What is the main benefit of using sodium oxybate in treating narcolepsy? A. It improves daytime alertness. B. It reduces episodes of sleep paralysis and cataplexy. C. It prevents nighttime sleep disruptions. D. It increases the amount of deep sleep. Answer. B. It reduces episodes of sleep paralysis and cataplexy. Rationale. Sodium oxybate is particularly effective in reducing episodes of cataplexy and sleep paralysis. While it can also help improve alertness, A. Its primary benefit is in controlling these specific symptoms. It does not prevent nighttime sleep disruptions, C, or increase deep sleep, D. 141. Which of the following is the first step in the diagnosis of narcolepsy? A. Conducting a sleep diary. B. Polysomnography, PSG, followed by a multiple sleep latency test, MSLT. C. MRI of the brain. D. Administering a blood test. Answer. A. Conducting a sleep diary. Rationale. The first step in diagnosing narcolepsy often involves conducting a sleep diary to track symptoms like excessive daytime sleepiness and sleep attacks. Polysomnography, B, is typically performed after initial assessment. MRI, C, and blood tests, D, are not diagnostic of narcolepsy. 142. How do stimulant medications help manage narcolepsy? A. They induce sleep and reduce sleep attacks. B. They promote wakefulness and help reduce daytime sleepiness. C. They increase the duration of REM sleep. D. They treat sleep paralysis. Answer. B. They promote wakefulness and help reduce daytime sleepiness. Rationale. Stimulant medications, such as modafinil and amphetamines, promote wakefulness and reduce daytime sleepiness in individuals with narcolepsy. They do not induce sleep, A, increase REM sleep, C, or treat sleep paralysis, D. 143. Which of the following is an important consideration when diagnosing narcolepsy in adolescents? A. Narcolepsy is rarely diagnosed in children or adolescents. B. Symptoms such as sleep attacks and cataplexy may be mistaken for behavioral problems. C. It is often mistaken for insomnia in adolescents. D. Adolescents rarely experience sleep paralysis. Answer. B. Symptoms such as sleep attacks and cataplexy may be mistaken for behavioral problems. Rationale. In adolescents, symptoms such as sleep attacks and cataplexy can be misinterpreted as behavioral problems or attention difficulties. Narcolepsy is diagnosed in children and adolescents, A, and it is not often confused with insomnia, C, or absence of sleep paralysis, D. 144. Which of the following is true regarding the use of antidepressants in narcolepsy treatment? A. They are used to treat excessive daytime sleepiness. B. They are primarily used to treat cataplexy. C. They are not used in the treatment of narcolepsy. D. They help improve the quality of REM sleep. Answer. B. They are primarily used to treat cataplexy. Rationale. Antidepressants, especially selective serotonin reuptake inhibitors, SSRIs, are used to treat cataplexy in narcolepsy due to their effects on serotonin. They are not used for excessive daytime sleepiness, A, nor are they focused on improving REM sleep, D. They have a role in narcolepsy management, C. 145. What impact does narcolepsy typically have on an individual's career? A. It generally has no impact on career success. B. It can make it difficult to maintain regular work hours due to sleep attacks. C. It leads to frequent job changes due to extreme fatigue. D. It results in frequent absences due to insomnia. Answer. B. It can make it difficult to maintain regular work hours due to sleep attacks. Rationale. Narcolepsy can significantly impact an individual's ability to maintain regular work hours because of unpredictable sleep attacks. It may not cause frequent job changes, C, or absences due to insomnia, D. It can have a notable impact on career success, A. 146. Which of the following is a primary cause of narcolepsy? A. Genetic mutations and a deficiency in orexin. B. Chronic stress and poor sleep hygiene. C. Autoimmune destruction of the hypothalamus. D. Long-term use of sedative medications. Answer: A. Genetic mutations and a deficiency in orexin. Rationale: narcolepsy is primarily caused by genetic mutations that lead to a deficiency in orexin, a neurotransmitter essential for regulating wakefulness. While chronic stress, B. Autoimmune destruction of the hypothalamus, C. And sedative medications, D. may affect sleep, they are not the primary cause of narcolepsy. 147. Which of the following is most commonly associated with narcolepsy during sleep onset? A. Sleepwalking. B. Hypnic jerks. C. Sleep paralysis. D. Night terrors. Answer: C. Sleep paralysis. Rationale: sleep paralysis is a common symptom in narcolepsy that occurs during transitions from sleep to wakefulness, often involving an inability to move or speak. Sleepwalking, A. Hypnic jerks, B. And night terrors, D. are not typical of narcolepsy. 148. Which of the following is a secondary consequence of untreated narcolepsy in individuals? A. Increased risk of obesity. B. Higher incidence of seizures. C. Impaired social interactions and reduced quality of life. D. Decreased risk of depression. Answer: C. Impaired social interactions and reduced quality of life. Rationale: untreated narcolepsy can significantly impair social interactions and reduce an individual's overall quality of life due to excessive daytime sleepiness, sleep attacks, and social stigma. Obesity, A. Seizures, B. And a decreased risk of depression, D. are not primary secondary consequences of narcolepsy. 149. What role do behavioral interventions play in managing narcolepsy symptoms? A. They focus on increasing REM sleep duration. B. They help manage symptoms of excessive daytime sleepiness. C. They help manage sleep-wake cycle disruptions. D. They provide a cure for narcolepsy. Answer: B. They help manage symptoms of excessive daytime sleepiness. Rationale: behavioral interventions, such as scheduled naps and consistent sleep routines, are important for managing daytime sleepiness in narcolepsy. They do not increase REM sleep duration, A. cure narcolepsy, D. or directly manage sleep-wake cycle disruptions, C. 150. Which diagnostic test is considered the gold standard for confirming a diagnosis of narcolepsy? A. EEG, electroencephalogram. B. MRI of the brain. C. Multiple sleep latency test, MSLT, following polysomnography. D. Blood tests for orexin levels. Answer: C. Multiple sleep latency test, MSLT, following polysomnography. Rationale: the gold standard for diagnosing narcolepsy is a combination of polysomnography and a multiple sleep latency test, MSLT, which measures the time it takes to fall asleep during the day. EEG, A, and MRI, B, are helpful for ruling out other conditions, while blood tests for orexin levels, D, can assist, but are not considered the primary diagnostic test.